All right, so I know I just made a post teasing about a full-length video about foam rolling, and I am going to do that today or tomorrow. But I want to do a quick check-in while I was on the bike training. So a couple things. Number one, this is the third video. So I started a week and a half ago, and I am down about 5 pounds in that time, for anybody that might be wondering. And in my last video when I was talking about nutrition, literally at this point I've only just worked out 3 days a week for the last week and a half and done my nutrition based on the concepts that I gave in that video. I haven't dialed anything in. I'm not counting calories. I'm just kind of having smaller, well-rounded meals, spacing them out to 5 a day, and training for about 20 minutes at a time, 3 days a week right now. So there's that. The other thing, while I've got you here, just a concept I was discussing a day or two ago with a patient of mine, was in reference to fascial health. And in reality, I get people that come in all the time, acute injuries that have been, healing for weeks or months, or repetitive stress injuries, or what have you. And oftentimes, if we treat the fascia before even attempting to treat the muscle tissue, we get such good results. We don't even have to treat the muscle tissue. The muscles kind of go back to the way they should be on their own. So what I'm finding is, number one, and I wish I could say, because 20 years ago I could say, children had healthy fascia, adults don't. But the reality is, these days, even children sit around watching TV and they don't move. And so most of us have fascial adhesion on a systemic scale. And when you have that, it becomes a cyclical event where you end up with more inflammation over time, because the fascia binds things together and prevents movement inside the body between different layers. So, you got two muscles laying on top of each other that go in different directions, and if they're bound together, not only can they not fully move in whatever directions they're meant to move in, but they also can't fully relax to their neutral position. And so those muscles appear to stay partially excited or partially contracted, and it's just because there's no ability for them to return to a neutral state. And so separating that muscle tissue by treating the fascia fixes that problem, and then that muscle can fully return to a neutral state, rest, and become healthier, and also move through a full range of motion. And we have to think of it, systemically. If muscles can't fully relax, then the joint position can't fully relax. And if the muscle can't go through a full range of motion, neither can the joint. And that leads to repetitive stress injuries. It leads to altered arthrokinematic positioning, meaning joints that are not where they should be, like protracted or rolled shoulders, forward head posture. And then when you have an altered joint position like that, you have shear forces with basic movements that you wouldn't have had if you were neutral. And that can lead to acute injuries far more easily, like doing basic simple things, just bending, stooping, reaching. Whereas if you had neutral joint positions and healthy muscles and healthy fascia, it would take something a lot more extreme to cause you injury than simply walking up a flight of steps with a grocery bag in one arm. Anyway, so yeah, just thinking about that, and the fact that I spent years and years working on muscle with people, length tension relationships, and altered arthrokinematics from a muscular standpoint. But over the last several years, for those of you who don't know, I've been doing this about 29 years. And so over the last several years, I have been focusing more on treating fascia first. And pretty much everybody needs that fascial treatment. Everybody. When you're working on like athletes, pro level athletes, you'll find a lot less adhesion. It's not systemic like it is on the everyday person, but they still need fascial work, because anywhere that they're getting inflammation, especially on a consistent basis, inflammation that, if you can help control it with like ice baths, contrast hydrotherapy, things like that. But if you've got a knee that sat swollen for 24 or 48 hours, that inflammation only needed to be there for 20 minutes. And then it should have been flushed out. And then, we encourage it to come back and flush it out again every 20 minutes or so. And if it sits there for 48 hours, it's starting to create fascial binding where that inflammation exists. So now, even if you flush it all out of there, you're going to go back, you're going to find fascial adhesion where that swelling and inflammation was. And that's going to affect the performance of that runner. So everybody needs fascial work, but done right, a lot of people after the fascial work will need a lot less muscle work. And I'm sure there's a few people out there in the industry right now that are going, well, you can't treat one without the other, or the fascia exists even within the muscles, and that's true. What I'm talking about is not focusing on muscle release before focusing on fascially releasing the peri fascia, around the muscle, between the muscles and the bones, between the tendons and the joint, because the tendon is supposed to be the attachment, not additional fibers caused by fascial restriction and adhesion. And so getting rid of, or not rid of, but remodeling is a better term, because we're not removing it, we're remodeling it. Remodeling that fascia, allowing the hydrolonic acid to exist between all the layers as it's supposed to allow it to stay separate and allow that movement to occur, needs to come first in most cases. Now obviously if a patient comes in, they're like, oh, this muscle is, my hamstring is in constant spasm since my last run, we're going to treat that muscle treat the nervous system to relax that muscle and then flush that muscle. That's different. We're treating an acute issue that demands immediate attention. But in general, that same person, once we've dealt with that and we've moved on to treating the person as a whole so that that condition doesn't continue to come back, a lot of times we're going to find that hamstring is overactive because it's doing the hip extension instead of the glute. And the glute is neurologically, chronically inhibited by the hip flexors. And the hip flexors are weak and short. And because they're short, when that person's in a standing position, they're constantly being engaged, which then, by reciprocal inhibition, shuts down the glute, and the hamstring becomes synergistically dominant and starts doing that job for it. Anyways, fascia first. That's maybe not exactly a motto, but something I've been working with for a while now. And just think about it, whether you're a practitioner or an individual, right? For those of you who that might be a little bit technical, you're watching this and going, I think I'm kind of getting the idea. If you're old enough to have seen Jackass, just think of it this way. If Johnny Knoxville handed you a pair of footy pajamas for Christmas and you thought it was a cute gift, and you put them on and they were full of super glue, now you can't get them off. And if you've never worn footy pajamas, just understand once they're on, Can't do a whole lot. They're very restricting. If you tried to bend down and touch the floor or pick up another package, they'd split you in half right up the backside. And so imagine being stuck in a pair of pajamas like that kind of permanently because you got glued into them as a prank, right? Now all of your movements are restricted and you're going to get real anxious. And if you've ever been really anxious before, you know what that feels like. There's like all this chemical anxiety throughout your body and none of your muscles can fully relax, right? So think of kind of that same thing when we're talking about systemic fascial restriction, except that it's been that way for so long that your brain found a way to compartmentalize, sort of relaxing somewhat into it so that it's not as obvious anymore. Anyway, fascia first. I'm not a big fan of static cupping. I'll say that right up front, unless we're reattaching a limb on somebody. Dynamic cupping. Lift your dermis up into the cup and glide, because the whole point is to pull the dermis and the superficial layers directly under it off of the deeper layers, and it makes a huge difference. Yeah, it's painful if it's needed. Now I'm gonna say it again. It's painful if it's needed, because if your fascia is free, if your superficial fascia is not restricted, you can pull that dermis up inside that cup and you can run that all over the place and it'll feel good. It won't hurt. It hurts because you're pulling nerve endings apart that are stuck together that aren't supposed to be. And so they're getting, the friction is hitting the end of those nerve endings and it's exciting some things. And that feels like an uncomfortable sensation. A lot of people call it pain. It's productive. Don't leave it sitting in one spot. Bruise people up. Leave big hickeys. This isn't like a how big of a hickey can I leave and then run around having people ask me, oh, do you do cupping? No. Put the cup on. Drag it around. Lift the dermis. Lift the superficial layers. Separate it. It'll feel so much better afterwards. And so dynamic cupping, scraping, gua sha, done right, can make a huge difference in the area that has been done in. And in most cases, I suggest starting with that before trying to address chronic muscle issues. And for the practitioners out there, when you've got a patient, client that's coming in and they've got the same hypertonicities, the same muscle tension every time you see them, it comes down to one of three things. Repetitive stress injury because they're doing something all day, every day that causes it, and that's normal, but those people usually fall into the category of length tension relationship issues, meaning muscles on the other side of where you're working on have shortened and tightened, and they're going to hold the muscles you're trying to work on in a lengthened position, which is going to piss them off constantly. So if you want them to stay relaxed, you've got to figure out how to get that muscle to a neutral length by addressing the opposite muscles. And before you even do that, on the side of the opposing muscle groups, look for fascial restriction, because that's a big factor, a big key. And if the person doesn't have altered arthrokinematics, if they don't have postural deviations and the muscle won't stay relaxed, look for fascial restriction around the muscle you're trying to treat instead of just treating the muscle itself. Make sure that it can extend to full length and relax to its shortest position. Start there. Bet you anything, you get better results. Learn how to do dynamic cupping, scraping, gua sha. Do that first. There's a reason that those techniques have been around longer than the Swedish massage they teach you in school or any of the other massage muscle techniques. So, food for thought. And for those of you that are going, who the hell is this guy? My name is Marshall. I'm a retired athlete, a manual therapist, corrective exercise specialist, TRX instructor, nutritionist, the list goes on. I've been in this industry for 29 years. I have a chronic disease that attacks my immune system. So it's autoimmune, and I spent about 2 years pretty much bedridden. I gained about 90 pounds. And right now on this channel, we're going to cover everything from massage and manual therapy techniques to, and that includes for the practitioner as well as for people at home to learn how to work on themselves, to training, nutrition, and I am working on my own 90-pound weight loss, and we're going to talk about that and things I'm doing and what you can do. So if you like that kind of content, hit like, subscribe, follow me, spread the word. If I get enough followers, I can do this full time and even work on patients who don't have insurance or don't have the ability to pay to get healthy for free if I'm making money off of making these videos. So help me out, spread the word, let's do this. Maybe we can start a trend, a whole different kind of preventative health care in America where it's free. So like, subscribe. I'll see you in about 24 to 48 hours in the next video about foam rolling. In the meantime, have a safe and happy 4th of July. See you soon. Namaste.